The current status of the poor in Guatemala is dismal. Being poor and indigenous is even worse, and being a woman on top of that leaves this population extremely vulnerable to abuse and lack of healthcare and education. Currently, one big consequence of this is that cervical cancer is the #1 cancer-related death. But at the same time, cervical cancer is also the most preventable cancer there is. Just a simple screen can be enough to detect cervical cell changes or suspected cancer, and oftentimes it's simple to treat and can be treated on the spot. Because of these facts, we at Humanity First have been providing women's health camps for over a year and a half. There are 3 major parts to our camps: clinic, education, and research to stay current and assess needs.
My name is Tahir Rijaz. I'm an oncologist in California, United States. This is my first trip to Guatemala. Coming here has been a very useful experience. Part of the team here has been to screen for cervical cancer and breast cancer. So the last few days we've been busy doing that, seeing 100 to 200 patients per day.
My name is Tessa. I'm an oncology nurse from the United States. This is my first time with Humanity First in Guatemala and their women's health camp. I think it's important to volunteer because where I come from, if I want to go to the doctor, it's free with my insurance and I can get any treatment I want or need. But here we've seen some women that have probably never been to the doctor before.
I'm Irene. I'm a high school volunteer. This is my first volunteer trip abroad here in Guatemala. And at first I was a little wary because I'm one of the younger volunteers, so I thought, will I be able to help out? But definitely anyone who wants to can come and help out because everyone works together and everyone has their own role in the run of things.
My name is Atiya Chaudhary, and I am a policy analyst with the Association of Maternal and Child Health Programs. I am a first-time Humanity First volunteer, and this is my first trip to Guatemala for the Women's Health Clinic. As I am a professional in the field of women and children's health, I am seeing a lot of need here in Guatemala for very basic services. There continue to be so many issues that the women face with, that they deal with on a daily basis. High rates of maternal mortality, high rates of infant mortality. And while these are the same conditions that we see in the U.S., it's really important to provide those same services to women in the developing world.
Clinically, there has been great progress made. Over the last 6 camps, we've served over 3,000 women. That's only over a total of 28 clinic days. Most recently, we not only were able to provide cervical cancer detection, we were able to treat some of the confirmed cancer cases the same day through a method called cryotherapy. In our latest camp, we treated 19 women with cervical cancer lesions free of charge. 19 women who may have died.
One of the main things we offer is cervical screenings because cervical cancer is one of the main leading causes of death among women here.
Para mí es muy importante estas jornadas porque ya como mujer, ¿verdad? Ya como señora nos sirve bastante para tener más que todo la salud de uno. Y la mayoría de mujeres no se la hacen y ahí es que quiera no se llegan a enfermar.
Para mí es importante para ver nuestro cuerpo si está bien y para ver nuestro cuerpo porque es importante porque es el aparato que da vida a nuestros hijos. Yo exhorto a todas las mujeres que vengan a hacerse su papá Nicolau porque es importante para que ellas detectan si están bien o están mal. Y es necesario, y agradeciendo a todas las que vienen del extranjero a colaborar aquí con nosotras.
I conducted a couple workshops on was domestic violence. So out of all the countries in Latin America, Guatemala has the highest rate of domestic violence. So it's definitely a prevalent topic.
En todos los lugares hay ese tipo de violencia, maltratos de los esposos hacia las esposas, y maltrato sexual que sin y psicológico y maltrato de infantes. Todo eso sí es muy bueno que den charlas para las mujeres.
Muy importante porque ya que hay muchas mujeres sí, ya que viven así de tantas violencias, tanto maltrato, y ya que uno de mujer tiene sus propios derechos también y se tiene que saber defender.
Aside from the health disparities, Guatemala has one of the highest rates of femicide in the world, further making being a poor indigenous woman there an even more deplorable combination. This is why domestic violence is one of our topics for our educational sessions, which is the other major component of our camps. Educational sessions are a key in helping women become more aware of how to prevent or detect health problems. Some topics that we teach include mental health, common female cancers, family planning, pelvic infections and STIs, maternal nutrition, food safety, and more.
It's been a deep privilege and honor to serve the women of Guatemala in this tour, and also going through some of the educational programs as well.
The Women's Health Camp typically is a week long with 5 days of clinic and changing locations. We also incorporate time to see and enjoy the beautiful Guatemala. Guatemala is a small Central American country below Mexico and next to Honduras with lots of lakes, volcanoes, and beautiful greenery. We stay in the picturesque UNESCO site of Antigua, filled with markets, ruins, diverse restaurants, and cafes. The local Humanity First staff sets up the camp in a comfortable stay for us. They hospitably ensure our safety and satisfaction from arrival to departure.
I've really enjoyed my time and my experience here. The people are so welcoming, so warm. Everyone is so just happy that we're here to provide these services. They're asking when will we return, and we keep telling them just look out for our camps. We'll be back. We hope so.
If you have a chance to volunteer with Humanity First, and especially abroad in a health camp like this one, definitely go for it, because it's something that you don't want to miss. It's a way to get in touch with other people and learn more about yourself.
So it's been such a wonderful experience, and I really hope that you all will take part in such a rewarding experience. It's especially as women, it's really important that we help strengthen the women of the world.
I've deeply enjoyed the opportunity and look forward to doing it again.
Pack your bags, register, and get signed up with Humanity First.
Anyone responsible and ready to help can join us, and medical or Spanish language background is not required. This was an experience that I was never able to forget when I was a new volunteer a couple years ago, and neither will you. You really can make a difference to another less fortunate. From the patients and from Humanity First, thank you for your interest, and we hope to see you soon.